Hi guys, welcome back again. Olá, sejam bem-vindos. Estamos de volta a mais uma live e esta acerca de um tema acho que bastante procurado. Vou esperar. I'm going to wait a bit for some people to come. Hello. So guys, let's bring your friends. Hello. Bring your friends. Just share the live with your friends. Just send, at least if you send to one of your friends, it's going to be very good, because we'll have a lot of people watching and learning about what granulomas, bumps are. Okay, it's something that a lot of my clients ask me about. Every single day I have people asking me about granulomas or bumps, so let's tell them to come and watch this live. Okay, let me just send to a few. So I'll give you just a few moments so that you can share with your friends, and I'll do the same. Portanto, partilhem com os vossos amigos, que é para aprenderem. Okay. Almost there. Ooh. So I'm almost finishing sending, and we will start. I think this is going to be a very, very good live. I'm going to explain to you what granulomas are, how you can avoid them, and the best thing, I'm going to tell you how to treat them. And we're going to talk about the NoPull discs as well. A lot of you ask me, so I'm going to at the end I'm going to talk about it. Okay, so wait for it. So we have a few people already here. If pessoal em português, façam perguntas em português, eu respondo em português, ok? Vamos começar. Let's start. So guys, granulomas, the bumps, the little bumps, those little things that most of you have on your piercings, and they are very, very stubborn, and they are a pain. Sometimes you feel pain, and they're very upsetting. So first of all, we need to understand what is a piercing. So it's like piercing it's the word, it's the action to pierce, okay? But we commonly use it for a piercing, a perforation, or the jewelry itself, okay? So, but let's talk about piercing. You need to understand that a piercing lets you wear jewelry in your skin, okay? So basically, it's a small wound. So piercings heal like any other wound, okay? So when you have a wound, what happens is our body has antibodies and cells that protect our body. So the skin repairs itself by producing a protein that it's called collagen, okay? And that protein gives the skin structure and strength, okay? So this collagen is most of the times it's called the building blocks of our body, okay? So sometimes our body doesn't know when to stop producing that protein, because there is something bothering the wound. So to help, the body produces more, okay? So when it produces more, sometimes it can be an excess, and a granuloma pops out, okay? So the granuloma is a small bump that can cause some pain and it gets inflamed. Okay, they are simple isolated bacteria that our body wasn't able to put out. Okay, so they can form anywhere in your body, anywhere, but they are very, very, very common on nose. Yep. On ear cartilage, on the chest, upper back, shoulders. So these are the most common places for the bumps to show up. So why the cartilage? The cartilage doesn't heal as well as other tissues. Why? Because we have less vessels, so less blood flow. So less blood flow, not many cells or antibodies go to that area. Okay, so it's simply as this. But don't be afraid, a granuloma can be healed, treated easily at home if you follow a few instructions. Okay, so when and why a granuloma come up? So we need to understand the healing process. We have 3 phases, like I mentioned on the other live. The first phase is the inflammatory phase, and it takes like 3 days, around 3 days. So the first couple of days you have that redness and you feel the heat and it's a little bit swollen and sometimes bleeds a bit. It's tender, so it's totally normal. Don't be afraid. That's part of the first phase of any wound, not just a piercing wound, any wound. Okay, so then after these 3 to 5 days, we enter the second phase. It's the growth phase, or the proliferative phase. It's during which the body produces these cells and protein, the collagen, to heal the wound, and then the edges of the wound, they contract around the piercing. Okay, and then there's a little tunnel of scar tissue that is formed, and it's called the fistula. Okay, it's normal to happen, some discharge. Some of you, after a week or so, you send me a message, or you try to, oh, Suvi, something is happening with my piercing. I have this discharge, this pus. It's not a pus. It's a normal discharge, and it's the lympha. Oh, it's the lymph, and it's totally normal. It's part of the healing process, as long as it's clear. Okay, and it's filled with healing cells. Okay. This second phase can go up to 2 to 3 weeks, around 2 to 3 weeks, but it can take longer if you don't take proper care or clean your piercing. Okay, so after these 2 to 3 weeks, so that's why, guys, your piercer tells you in a week or so, as long, at least I say, okay, this is the way I follow up my clients. After a week or so, I send a message asking how is it, and send me a picture. From the picture I can see if it's still red, if it's still inflamed, so I can see if we already entered the second phase of the healing process or not. Okay, so if you're taking good care of it. And then I tell you, after a month or so, let's do the downsize of the jewelry, because during that around a month, usually it's this second phase when the scar tissue starts to grow and contracts around the jewelry, and if we need to downsize the jewelry, it's safe enough to do it. Okay, so after this month or so, 2 to 3 weeks, we start the third and final phase of the healing process, that it's called the maturation or the remodeling phase. Okay, so the cells, they get around the piercing, and as the piercing stabilizes and gets stronger, the cells will keep on producing the scar tissue. This phase is when the granuloma, the bumps, or the keloids or the hypertrophic scars can happen. Okay, so you have to be very careful. And this phase is the last one that can take months or even years to be complete. Okay, so this only depends on how your body heals and how you take care of it. So the bumps, the granulomas, they can come out for two main reasons: a physical trauma and chemical trauma, chemical irritation. Okay, so the physical trauma, if you have any questions, just go for it. Ok, se tiverem alguma pergunta, por favor, façam a questão em português, eu respondo em português, depois traduzo. So the physical trauma can be like inflammation, infections, the tension on your skin. So how can this happen? If you keep on touching your piercing, so, oh, you have a nice piercing, oh, look at it. So your hands, if they're not clean, they cannot touch your piercing, okay? And you must keep your hands out of your piercing. So 2 rules. Rule number 1, don't touch your piercing. Rule number 2, keep it clean. Okay, simple as this. So don't touch your piercing. Don't play with your jewelry. So stop touching your piercing unless you are cleaning it. Okay? So what else? Wrong placement of the piercing. Sometimes people want a piercing so desperately that they don't bother, or it's not your fault, sorry. Let me rephrase this. Someone goes to a studio and they want a piercing. It's a piercer's job to check your anatomy and see if you can have that piercing, okay? Sometimes a piercer must say no. It's not possible to have it. You'll have problems. It's going to take a long time to heal. It's not safe, blah, 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 blah. But sometimes, most of the times, people, they just care about money and they do the piercing and now it's up to you, okay? No, it doesn't happen like this. It shouldn't happen like this, okay? A piercer should follow up and help the clients all the way. Yep. So, wrong placement. The body area, it's not suitable to have a piercing. Sometimes, like when the piercing is done, it's not done with the right angle. So the shape of the jewelry, ooh, a lot. Cartilage piercings, circular jewelry, they don't match, okay? They don't match. Nose piercing, circular jewelry, they don't match, okay? They need to heal with a straight jewelry, and it happens a lot. Cartilage, nose with a circular jewelry, okay? Don't allow your piercer to do it, and piercers don't do it, okay? So angle of the perforation, size of the jewelry, sometimes it's too short, it doesn't allow the normal swelling, and this will compress the skin, will not allow the skin to breathe, and of course there's a physical trauma, a bump, granuloma can come up, okay? And then normal things, daily things, hair getting tangled, so pulling, pushing, the piercing when you're dressing and undressing, the clothes get tangled, sleeping on it. Oh, that's the most common. Why, guys? Remember the first phase, 3 to 5 days, you feel pain and it's red, and so even if you sleep on it by accident, you will feel it, you wake up, you move to the other side, okay? Or even sleeping, you move to the other side. But after that first phase, so after that first week, you start on sleeping, yeah, you start on sleeping on it, and you're putting pressure, you're putting physical trauma on it, okay? So Tanya is saying that my piercer did my nose piercing with a very thin hoop. Yeah, that's so the the jewelry was not the proper one. It was very thin, and I think it was a hoop, wasn't it, Tanya? I've got a lot of problems, including granuloma inside. Yes, inside. And I remember that it took a long time for you to heal your nose piercing, wasn't it? More than a year because of that. And it only got better when you swapped the jewelry to a proper one, wasn't it? Yes, Tanya? So, physical trauma, and then we have the chemical trauma, or the chemical irritation. So, cosmetic, personal care products, they might have chemicals, and they are very, very harsh for to the body. And they irritate the healing of the piercing, okay? The area. So, for example, that includes makeup, sprays, scrubs. So be very careful, okay? Another thing that can cause chemical irritation, and it's very, very, very common. It was a hoop from Claire's. Yeah, so Claire's, guys, I don't have anything against Claire's, but they're not professionals on doing stuff, sorry. And the quality of the jewelry they use, it's not biosafety, so it's not very safe for your body. After it's fully healed, okay, go to Claire's and buy stuff from them, yes, but until it's fully healed, I don't recommend, okay? So, and this goes to this other reason that I was going to talk about. The material, okay? The material of the jewelry, the metal. If it's not good, it's going to cause problems. And guys, a granuloma, it's nothing. It can happen a severe infection, okay? And that's very dangerous. An infection, it's very dangerous to your body, okay? So be very careful. Surgical steel has a little percentage of nickel, okay? It has nickel. Nickel is a kind of metal, and it's not safe, not that safe to our body. And some gold jewelry as well has nickel, okay? So that's why sometimes gold is not the best thing to wear in a fresh piercing. People say, "Oh my God, it's gold. It's the safest one." No, guys, it's not the safest one. If it's not a good quality gold like 14K or 18K, it's not safe. Totally safe. It's not totally biocompatible because it has nickel. Okay. Besides other metals that can be very, very dangerous for our body. So the most biocompatible metals are titanium and niobium. Okay, niobium is a little bit more. It's a little bit safe. Not safer. They're the same, but lighter than the titanium. It's a bit more expensive. It's harder to find. So the titanium, it's pretty good. So guys, when I started, I learned a lot of things that were not correct, because I wanted to learn more and more and more. I got better and I increased my knowledge, and now I know that titanium is the best. So once I read this, I studied this, I stopped buying surgical steel jewelry. I still have it on my stock, and I only use it if I know the person, and if I know that person have a good healing, and it's not going to cause any troubles, or the chance of getting problems, it's minimum. But I'm sorry for those at the beginning that I put surgical steel on. I didn't know, so now I know, and that's why I tell you titanium is the best. Now I only buy titanium, and my clients maybe I had like in 10 clients I had 5 with bumps, with problems, and now I have like 1 or 2. Okay, so what you have to understand, there's no point in treating the symptom without knowing, without finding out what's causing that symptom. Okay, what do I mean about this? We have to think the same way with a granuloma. The granuloma, it's not the problem. Okay, the granuloma, it's a symptom caused by some problem. So we need to find out what's the problem so we can stop it, and then the granuloma will vanish. Okay, for example, if we are sick, we have a disease, something that generates symptoms. Okay, so when we go to doctor, he analyzes the symptoms and he finds out, he asks a lot of questions and things, and he finds out that we have this kind of disease. Okay, he finds out where the symptoms come from. Okay, so he will treat that disease. He will tell us, don't do this because this is causing those symptoms, and you'll have to take these kind of medicine in case we have to. So with the granuloma, it's the same way. We don't treat the granuloma if we don't know what's causing it. Okay, so we must find out where the granuloma comes from, what's causing that granuloma, so we can stop it, and then with time, granuloma will vanish, will go away. Okay, so keep this in mind. The granuloma, it's not the problem, it's the result of the problem. Okay, another thing that I want to talk about, a lot of you don't know the difference between a granuloma, a keloid, an infection, an abscess, or even perichondritis. Okay, so what are these names? A lot of you tell me, oh, Suvi, I have an infection in my ear. And I tell you, okay, send me a picture or come to the studio, let me see. And at the end, it's just a simple granuloma. It's a simple bump that can easily be healed. Okay, so granuloma, they are usually formed at the edges of the wound. Okay, you have the wound, and the bump, the granuloma, just shows around that area. They raise less than like around 4 millimeters above the surrounding skin, like 4 millimeters, 5, something like this. They are firm, and their color is like pink or red, and they can also be itchy, a little bit painful. Okay, after this initial growth period, and hey, what upsets me and upsets everyone for sure is that you go to bed, no granuloma, nothing, and the day after, the morning after, you wake up and you have a granuloma. Isn't it? Tell me. Isn't this what happens? Or what happened to you? One day you woke up and you had a granuloma, you had a bump. And you like, oh my God, what is this? It's an infection. No, it's not. So it can come out like this, poof, and then you expect it to go down, to disappear the same way, poof, but it doesn't. It takes a long time. It can take a long time, especially if you don't find out what's causing it. Sometimes it takes time to find out what's causing it. So it keeps on growing, it keeps on not vanishing. So, and you don't know what to do. But you have to be patient, okay? So with time, the granuloma can flatten and shrink and totally vanish, okay? A keloid. Sometimes you guys mistake a bump, a granuloma, with a keloid. No, a keloid, it's also an excessive growth of the scar tissue. Okay, it's also that, but it increases in size, and usually it goes over the size of the wound. Okay, so if you have a wound like this, and you have like a bump that goes over, it's most probably a keloid, okay? And it keeps on increasing and increasing. It's very thick, and it gets a red, like a red color, okay? And you can still have pain and feel some itchiness, itching. So the best thing you can do is go to your piercer, and he can tell you if it's a simple granuloma or if it's a keloid. Guys, many doctors believe that keloids are linked to human genetics, okay? So some people are more likely to develop keloids, especially if you're over 30 and if you have like darker skin. Yeah. So they are not dangerous. The keloids are not dangerous, but statically they don't look nice. So with the keloid, you must see a doctor. You have to go to a dermatologist. Your piercer cannot help you with a keloid. If any of your piercer tells you that it can do something about the keloid, please run away from it. No, we can help you treat the granulomas, but not a keloid. A keloid, you must go to a doctor, to a dermatologist, okay? They will see what is the most appropriate treatment, and in some cases it only helps with some surgical procedure, okay? So you also have an abscess. It's not that common, but it can also happen. It looks like a granuloma, but it has pus inside, okay? That it resembles like a pimple. You also need to see a doctor if this happens, okay? And then you have infections, okay? Infections are also mistaken with granulomas and vice versa, okay? So remember this, swelling is common during the first few days, okay? But if this swelling continues for the next few days, and it's a severe swelling and a severe pain, this is a warning sign, okay? So the pain, if you feel like severe pain and burning, like some heat is normal, but burning, it's also a sign of infection. And then you can search for if you have fever, yeah, that's a sign of infection. And if you have pus that is not whitish, like liquid, transparent, no, if it's like light yellow, not light yellow, like dark yellow, orange, green, brown, something like this, and it's not, it's thick, so you must search a doctor immediately. That's an infection and it needs to be treated properly, okay? That's not a bump, a simple bump that you can treat it at home, okay? So the most important thing now, how to avoid it. Yep, everyone wants to know how to avoid a granuloma. Do you know how to avoid it? From what I've been telling you, can you tell me how to avoid a bump to come up? Come on, I want to listen to you. No one knows how to avoid a bump to come out, or you just think that every single piercing will have a bump. No, it happens a lot, but you can do something to avoid it, okay? So most of the ways, most of the times, it's simply genetic, okay? You can have it, but you can do things to lower the risk of getting it while your piercing is healing. Okay, so first of all, if you know that you're prone to scarring, make sure, yep, Tanya, taking care of the piercing, yes, but if you already know that you're prone to scarring, make sure you find a good professional, a good piercer that knows what to do and how to do things, okay? And important, very, very important, uses sterilized material, okay? And good quality jewelry. This is the first step. This is the first step. Olá, Cristina. Se tiveres alguma pergunta, em português eu respondo em português. So, find a good professional that sterilizes stuff, uses sterile material, the clamps, the needles, the jewelry, everything must be sterilized, and good quality jewelry, okay? If you have any questions about this, I'm going to do a live about jewelry, about sterilized stuff, so we will talk about it. So, clean your piercing, like Tanya mentioned. Well done, Tanya. Clean your piercing, following your piercer's instructions, okay? Don't do anything differently unless you went to a piercer that actually doesn't know quite well what he's doing, and that happens a lot in Egypt. Sorry, it happens still. Here in Portugal it happens as well, so it's not the only place. Everywhere around the world you have people that only wants to get your money, and they don't invest on studying, on getting better material, better jewelry. So yeah, it happens everywhere. So leave your jewelry alone. Don't touch your piercing while it's still healing. Don't turn it. Don't move it around. This is an outdated recommendation. I learned like that, and I've learned that it's totally wrong. So don't turn your jewelry. Don't move it, and only use products that are recommended by your piercer. Okay. So you shouldn't apply any kind of oils or any creams, any products that your piercer didn't recommend you, okay? Don't apply the soaks with reusable towels. They have a lot of bacteria. Always use clean paper towels and that you can dispose after. Don't use, let me show you. I brought, so paper towel, clean paper towel. Mine is blue. Commonly you have the white one, so use this. Don't use cotton, okay? Tissue, these, it's very, very common. This tissue, paper tissue, or cotton swabs, cotton balls, don't use them because they can release little fibers that get stuck in your piercing and it can create a severe infection. Don't change the jewelry unless your piercer says it's fine, and your piercer should change the jewelry, okay? And again, don't play with your jewelry. Oh, very nice, especially like the tongue or the belly piercing. You always like playing with it or whatever, okay? All these habits can irritate the area wound and can create serious problems, not just granulomas, okay? So how should you clean it? With saline solution only, guys. It's never too much to mention. This is the best thing you can clean your piercing with, okay? Why? It is a natural and sterile product. If you buy these individual ones like 5 milliliters or 10 milliliters, these are sterile, okay? So it's safe, okay? they are functional as an isotonic for the cells, and the skin with the saline solution, the skin becomes stronger and the pH stays balanced, and that's very, very important and allows a faster healing. Some of you ask me, oh, can I use alcohol? No, okay, because it dries the skin. The skin needs the natural moist to heal. Okay, can I use other products like other sprays? Some of them kill, they kill the bad bacteria, but they also kill the good bacteria. Okay, obrigado, Zeca. So we need the good bacteria, and some stuff that you use, they can kill the good bacteria as well. Okay, so saline solution is the best. These individual ones, they are more suitable for the daily use and for making warm compresses. How do you do them? So I'm going to do a live about the compress, the soaks, but easily you can just use one of these. If you have the gauze, you have like different sizes. They are sterile, so they are swabs. These have a lot. These have like 4. These have like 2 or 1. So I like these better because I open one, and I'm going to give you an example. So I open one and I do like this. I open a saline solution package and I soak it. I soak the gauze really well, okay, and always, guys, like I mentioned before, from the back to the front, and leave it there 5 to 10 minutes, okay? Remember, if you want to do a warm compress, and warm soaking helps a lot with the bumps, you can just hold it in your hand for a couple of minutes. You know that you're going to do the soaking, so hold it, keep it in your hand for like 10 minutes, do your stuff, normal stuff, and after those 10 minutes it's at your body temperature, okay? This is a tip that I've learned from Zeca. Eu aprendi com Zeca. So keep it in your hands. The other thing you can do is like put it in a water bath, like warm water, and you put it there, leave it for a couple of minutes, and it's going to be warm. This warm compress will help even better with the bump, because it will increase the blood flow. Okay, remember, if you don't have these and you have the big ones, everything that is sealed and sterile and it's open, after 24 hours it's not sterile anymore. Okay, so these are better than the big bottles. Okay, you can also have like a spray, as long as it has this. Okay, it's sodium chloride 0.9%. Okay, so this is the percentage, the right percentage to our body. Okay, it works like a magic every time when the bump come back. The warm compress, isn't it? Yeah. So use the spray the compress until it's soaked, look, yeah, and apply it, okay? 5 to 10 minutes, leave it there, and then at the end, most important, always tap dry your piercing. Tap dry gently, okay, because bacteria, they like humidity, so always use it and throw it away. This is how to avoid, okay? When the bump comes out, you already have it. If you see it, always visit your piercer, okay? So that he can check if it's a granuloma, if it's a keloid, if it's an infection, whatever, and then your piercer will recommend. Hello, Hannah. We're talking about, watch some TV while you have the soak. Yeah, that's a good tip. Lay down and relax and have it for 5 to 10 minutes, okay? So if it is a granuloma that your piercer tells you that you have, the first thing you should do is, again, identify what's causing it. After this, you must keep the proper care by cleaning it daily. So check with your piercer if you don't need to swap the jewelry, downsize, or to a different metal. Sometimes that's enough. Remember the physical trauma and the chemical trauma? So these are one of the reasons. So you must go to your piercer to do it, okay? Don't swap the jewelry by yourself, okay? Always remember, before you touch your piercing, before you clean it, wash your hands very well, okay? Don't use products with fragrances. Yeah, that's the way you say it. So in Egypt, I recommend the Dettol, the green one. It's neutral, doesn't have any perfume, anything. So that's the best one. So wash your hands properly, then clean up your piercing with the saline solution. Some of you, the Q-tip, okay, it's cotton. Yes, it is cotton. But since you're not like applying much pressure on it, it's not that easy to release the fibers and get stuck in your piercing, okay? So make sure you use it gently around your piercing, okay? Use it with a gauze or a Q-tip, never with your hands, okay? Yeah. So the saline soaks will help. They will speed up the healing. The warm soak will help even better because it helps with the blood flow. Since the area is inflamed and the heat increases the local blood flow, it helps to reabsorb the hematoma and promotes relaxation on the area, okay? Sometimes people think it's the one we use to clean. Dettol hand soap. Yes, thank you, Tanya. It's the Dettol hand soap, the liquid one, not the bar or the ones you use to clean your house, okay? Totally different. It's the hand soap. Thank you, Tanya. The Dettol. So the warm compress also helps you with the pain release, okay, caused by the inflammation. Do this twice a day if you have a granuloma. If you don't have a granuloma, a bump, do it once a day to prevent. Remember, you can do the soak to prevent the granuloma to come out. So, if you have a bump, the soaking, it's the first solution. So guys, it's not, we don't have a magical recipe. It's just this. This is the best you can do. Cleaning, soaking with saline solution. The best. Okay? For the soaking, the gauze, it's better. Or even a paper towel, tissue, this paper towel. It's better than the Q-tip, okay? Some say that the chamomile soak, it's also good. It also helps. Look, guys, I don't have any. They are not. There's no studies that tells you that this is a fact. But a lot of doctors talk about the chamomile because of the antioxidant and anti-inflammatory properties, okay? And they say it can be used and it's good. I've saved a few piercings with this tip, so it worked with me, okay? So it's the same. Just prepare a chamomile tea. Simple as this. Soak a gauze and again apply it back to the front and leave it there for 5 to 10 minutes. Guys, it's warm, okay? You prepare the tea, you let it warm down, okay? Cool down a bit until it's warm, and then you can apply it. Don't put hot saline or hot liquid here, because then you have to heal the bump and you have to heal the irritation you have around the skin, okay? Careful. So, just one thing. If you're allergic to ragweed, don't use chamomile, okay? No, don't use it. You have the saline soaks, okay? Always tap dry. Always tap dry your piercing. See you, Hannah? So, other tips. We have silicone gel. Some pharmacies you can find them like in patches or in a gel. Yeah, they can soften and flatten any scar. Okay, they can help, but you will need to apply it twice a day, and you must massage a little bit. So if you can find it, yes, they can help. And the easiest and cheapest way to break down scar tissue is by putting some pressure on it. Okay, you can use some massages, some bandages, some tapes, but the best thing you can use is a NoPull disc. Okay, they can be very, very helpful. They can be very, very helpful on this. So, oh, no questions. Let me see if I can do something here. Okay, so let me see if I can just invite here. So guys, the NoPull discs, they are made of a specific medical silicone used to aid in scar healing. Okay, they are not medicated, no, but they help a lot. It's the silicone itself that heals. Okay, the gentle and direct touch with the natural moist of the clean skin will help smooth out the collagen. Okay, it's very safe, it's very comfortable, and it's very effective. Okay, so, and the best thing, they are reusable. Only the same person. Okay, you don't use an NoPull disc and then give it to your friend or to your sister or whatever, or your cousin. No, it's reusable by you, by the same person. Okay, and another good thing, it's that they can be sterilized, and they have to be sterilized on an autoclave. Okay, so make sure you find authentic NoPull discs. Okay, you must go to a piercer that sells authentic NoPull discs, okay? It's autoclave safe, it's approved, and it's medical grade silicone, okay? So they look like this, if you don't know it. So, if you don't know them, I can show you. These are not sterile yet, so they come like this, and then we put it in like a little bag like this, and they go to the autoclave to get sterilized. So guys, can you see it? Or maybe against this? Yep. So this is a silicone NoPull disc, and it's an authentic one. So someone is asking me, Vânia, sabão líquido para lavagem, recomendo? Não. Depende do sabão. I will translate it to English after, okay? Depende do sabão. Nós recomendamos sabão líquido se for neutro. Mas muitas das vezes as pessoas utilizam o sabão que têm em casa. E mesmo os sabões antibacterianos, eles às vezes são muito fortes para a ferida. Assim como quando nós temos uma ferida, não vamos colocar lá sabão, é desnecessário. Há quem recomende, eu já recomendei. Comecei a perceber que as pessoas tinham alguns problemas, portanto deixei de recomendar, porque com o soro é mais que suficiente. Tá bem? O sabão líquido, sim, para lavar as mãos, é muito bom, tá? Às vezes só lavar no banho, pôr um bocadinho da pressão do chuveiro é suficiente para fazer a lavagem. E depois lavamos com o soro. Tá, Vânia? So Vânia was asking me if the liquid, the soap, if I would recommend it to wash it. It depends on the soap, the liquid soap. Before, I used to recommend washing your piercing with that, but I don't recommend it anymore, because I realize that the saline solution is enough. Okay? It's not too late, Marina. It's not too late. No. No, it's not too late. Wait for it. So, you can use the soap. Yeah. So, you can use the soap to wash your hands. The book is on the table. O livro está na mesa. Caraças. Max, o que é que isso quer dizer? Nada, Vânia. Olha, mas se limparem bem com o soro é mais suficiente e não vão ter problemas. Muitas das vezes nós pensamos que o não usarem o sabão é que está a criar o problema, mas não, é de dormirem em cima, ou a joia que está a criar atrito, ou mesmo estão a mexer no piercing, não lavam bem as mãos, portanto, muitas das vezes não é o sabão, é tudo o resto. Mas para evitar, o soro é o melhor. So, saline solution is the best. Don't use anything else that can that can cause any trauma in your piercing, chemical trauma. É a primeira frase em inglês que aprendemos na escola do Brasil. Opa, tu és demais, Max. So, hi Basma. So, the NoPull, I was talking about this. Guys, make sure you find... Esta é uma dica que aprendi com o Max. Make sure you find an authentic one. The fake discs, there are a lot of fake discs being sold at the market, especially the Chinese market, and they are made with some plastic that can be very, very toxic to our body. Okay, and instead of healing, it will increase to a bigger problem. Okay. So guys, I know that in Egypt I'm the exclusive seller of NoPull discs, okay? I know in Portugal, I can tell you, But be careful when you buy it. Qual a função? Ok. Let me just finish this. Deixa-me só acabar. Be careful when you buy it in the online. Okay. It has to buy it online. You have to go to the NoPull website. Okay, the NoPull Disc website, and it's www.nopullpiercing.com. www.nopullpiercing.com. They sell the original ones. They are the ones that have the authentic ones. Don't buy anywhere else that you're not sure what they are made of, and instead of healing you will have bigger problems. A Vite pergunta qual a função deste silicone. Refere-se ao disco NoPull, não é? Este disco, a função dele é fazer uma pressão constante sobre o granuloma, porque ele tem esta bolinha que entra na joia e faz uma pressão constante no granuloma e faz o granuloma diminuir. O seu contacto com a pele, com a gordura natural da pele, vai fazer com que o granuloma vá desaparecendo. Portanto, tal como a Vânia diz, NoPull is the best. Ela usa já há bastante tempo. Eu já a levei para o Brasil, para o Egito em 2017 e perfeito. So they were asking me what was this for, and I was explaining in Portuguese. So this applies a little pressure on the bump, and it goes into the jewelry, and it helps healing the bump. It's the best thing. So in Egypt, I'm the only one that has it for now. In Portugal. Então, em Portugal, a Vânia Body Piercer. Vânia, tu estás aonde? Só para recomendar. A Vânia tem, podem ir lá. Eu sei que em Coimbra o Shark Piercer usa NoPull. Portanto, vou pôr aqui. O Shark usa NoPull. Eu vou deixar aqui. Vou escrever. Ora, a Vânia está em Gondomar. Vou pôr aqui. Vânia Piercer. É isso? A Vânia está em Gondomar. Vânia Body Piercer. Deixa-me pôr aqui. Usa NoPull em Gondomar. Em Loulé têm a Joana Matias usa NoPull em Loulé. A Vera Fernandes usa NoPull em Vila Real de Santo António. E eu, não é? Uso NoPull em Faro. Ok? Tem aqui os comentários das pessoas que eu conheço. Portanto, se conhecerem mais alguém, podem me dizer e eu recomendo. Ok? So, guys, this is a very, very good thing. It will help you a lot. If you don't have it, come on. We already talked about how to prevent it. Okay? If you prevent it to come out, you will not need this. Then if you realize that you have a granuloma, I already explained to you how to do the soakings, how to clean it, and even though if it doesn't help, you have the NoPull discs that will help you a lot. You can check on my page, I had a lot of cases, severe with like huge bumps, and in a couple of days, couple of weeks, they vanish and they never came out again. Okay, but be careful. Only use authentic NoPull discs. Don't use any kind of discs that people tell you, oh, it's a silicone disc, and you don't know what's made of. Okay, so be careful. Always search for the authentic one. So bear in mind, scars can take a long time, like a year, to fully mature. Okay, so this is about how long your skin needs to repair itself. Piercings can take long time to heal, and if you don't take good care of it, you can have the most common problem, the bump. After this, if you keep on not taking care, this can develop an infection or even a keloid or severe other severe stuff. Okay, so guys, thank you so much for being with me. I would like to ask you now if you have any other themes that you want me to talk about during other lives. Remédios de uso, quanto tempo em média? Let me just answer this. Vânia, normalmente entre 2 a 3 semanas, mas tudo depende da forma como está a cicatrizar. Eu já tive clientes em que numa semana o bump, o granuloma, desapareceu por completo. Portanto, é sempre ir acompanhando, e daí é importante o piercer acompanhar os seus clientes, ires acompanhando a evolução, a regressão do granuloma, e normalmente o que eu recomendo é, depois de desaparecer completamente, perceberes que o granuloma desapareceu completamente, deixar mais 2, 3 dias só para ter a certeza, porque às vezes fica um pequenino e não está completamente curado, e a pessoa depois, claro que facilita e pode voltar. Portanto, é ir acompanhando, em média entre 2 a 4 semanas, normalmente os bumps, mesmo aqueles maiores, acabam por desaparecer, e depois deixar mais 3, 4 dias e normalmente tá. Ok? Pronto. Vanya was asking me how long should we keep the NoPull. So usually it's like around 2 to 4 weeks, 2, 3, 4 weeks, but it depends how it goes. So that's why it's very important. If your piercer puts this on you, he must keep on following you up and see how the granuloma goes. Okay, with time the granuloma starts decreasing, and I recommend to keep it for 3 to 4 days more after the bump totally disappear. Okay, because sometimes it leaves like a little thing still, and we take the disc out and we think it's okay. We easy a bit with the cleaning and everything, and it comes out again. Okay, so keep it for a couple of days. Vit, muito importante, obrigada. Como se faz a limpeza com o NoPull? So guys, when you have this, I didn't eu não estava a entrar muito especificamente tão a fundo com o NoPull, porque estava a pensar até fazer uma live só sobre isto, mas posso já falar. Vit, a limpeza é igual, o ter o NoPull ou não ter, a limpeza do piercing deve ser feita igual. O que devemos ter em conta é ter a certeza que limpamos bem por baixo do disco, porque ele vai sempre acabar por acumular secreções, ok? E às vezes elas secam, e essas secreções, quando ficam muito tempo, não é? Porque têm bactérias, acabam por criar perigo à ferida, porque são bactérias que estão lá, que deveriam sair e não saem, não é? Portanto, limpar bem o disco na mesma com a solução salina, tá? E o que eu recomendo no banho, com um bocadinho, o chuveiro com um bocadinho de pressão ajuda a remover essas crostasitas que se formam, tá bem? So, Vit was asking me how to clean with the NoPull. It's the same way, guys, the same way. You clean it with the saline. You have to make sure, because when you have this, okay, you have to make sure you clean under the disc, okay, between the jewelry and the disc. Make sure this still keeps this clean, because since the disc is a bit larger than the jewelry, it accumulates some crusts, and when they get dry, they can get stuck. And so if you keep it there for a long time, it will not be very healthy for the wound, okay? So make sure you clean it. You can use the Q-tip, okay, with the saline, okay? The soaks will help you a lot. Vit, fazer as compressas ensopadas ajuda bastante, porque fica molinho e sai facilmente. So the soaks will soften the crust, and they will remove very easily. And what I recommend as well is, during the shower, if you put the shower with warm water with a little bit of pressure, okay, even without the disc, it will help remove the crust. They will get soft and they will go away, okay? It's easy. If the disc accumulates a lot of discharge and you can't remove it with the saline, Vit, se acumular muita porcaria e não sair com o chuveiro, eu vou dizer primeiro em português, em inglês, e depois já digo, tá bem? So if it accumulates a lot of discharge and it doesn't go away with the saline or nothing, or the shower, you can remove the disc. But guys, please only do this if you don't have a very severe bump, okay? Otherwise, go to your piercer and he will do it. He will clean it for you, okay? So you can remove the top of the jewelry, but if you have it on the back, you cannot remove the jewelry to take the disc out, because your wound is going to close, okay? So let your piercer do this, okay? Yep. But if it's on the top one, you can just remove the attachment, remove the disc, clean it, put it inside alcohol to clean it well, okay? And then you can apply it again. But it's safer if you go to your piercer. Vitor, o que eu estava a dizer é, isto é muito mais seguro ser o piercer a fazer, mas se acumular muita porcaria e se tenha que limpar o disco, pode-se remover o disco, tirando o topo, retira-se o disco e limpa-se o disco muito bem, mergulha-se em álcool, deixa-se algum tempo, removem-se as crostas, limpa-se muito bem com soro e volta-se a pôr. Mas isto nunca se o piercing ainda não estiver cicatrizado, e muito menos se tivermos um NoPull na parte de trás, não é? Que se tenha que tirar a joia completamente para retirar o disco. Isto porquê? Porque se a ferida ainda não está cicatrizada, nós vamos retirar a joia e o buraco vai fechar, e depois vamos causar um trauma maior ao inserir a joia. Portanto, é recomendar sempre que seja o piercer a fazer a limpeza, a não ser que o piercer diga, olha, ok, podes fazer em casa, mas só se for tirando o topo, não é? Portanto, cuidado. Olá, memé. Okay, guys, any other questions about the NoPull? If you want me, I can make a live specifically to talk about the NoPull. Se vocês quiserem, posso fazer uma live só para falar do NoPull, dos discos, e vocês tirarem todas as dúvidas. Proponham, mandem mensagem e eu faço aquilo que vocês quiserem. Ok? Just send me a message, tell me. Ok? Obrigada, Tata. Obrigada. Portanto, So guys, I was thinking about maybe in another live talk about the NoPull, talk about different kinds of soakings, the warm, the cold, yes, because you can do warm cold soaks, and you can also do mix. Portanto, eu estava a pensar falar do NoPull numa outra live e também falar sobre as compressas, o tipo de compressas, de... Como é que se diz em português, os soaks? Quem é que me ajuda? A saline soak, como é que eu digo em português? Agora não me lembro. Alguém que me ajude e me diga. Isto, falar tanto em inglês, às vezes esqueço-me. Portanto, vou falar sobre a diferença entre as quentes, as frias e as mistas, que podem ser usadas em situações diferentes. Se vocês tiverem outros temas, mandem mensagem. Falar sobre os tipos de joias, os metais, os formatos, as coisas esterilizadas. Portanto, estes são temas que eu tinha pensado. Se tiverem mais alguns, digam. Okay? So I was thinking other lives talk about the NoPull, the soaks. Pois, compressas. É isso, mas a gente diz compressas, mas eles dizem soakings. Pois, é que compressa é isto. Isto é uma gás, uma compressa. Pronto. Tanto faz. So, I was also thinking about talking about the jewelry, the kind of metals, the different kinds of shapes. And so if you have any other stuff that you want me to talk about, just let me know. So Marina says, my piercing did a hard tissue inside around the piercing, and I remove it. By the way, I don't know if it's a granuloma. How did you remove it, Marina? Tell us. How did you remove it? How I removed it? I don't know if it's a granuloma. So, I'm not sure if you were here at the beginning. So if you were not, I recommend that you watch it again. I tell you how to identify a granuloma. I removed the piercing. I mean, okay, okay. So if you remove the piercing, if you apply the soaks, it will help the bump to come out, but you cannot wear NoPull disc anymore, because if you removed and the hole closed, you cannot put this, because this only works with the jewelry, ok? Isto só funciona com a joia. Se vocês retirarem a joia e o buraco fechar, já não podem usar o NoPull, ok? So, please make sure. If, guys, again, there's a lot of things that can cause the bump. If, in this case, Marina, I'm not sure. I think I was the one that recommended you to remove the jewelry. I don't remember. Yeah, come back. Yes, I want this pandemic to ease down so I can travel. At this point, we are in lockdown in Portugal. We cannot travel. We cannot go out. So this is how we are now. The numbers are increasing like crazy. And at the moment, we are the worst country in the world in terms of percentage. So yes, this is how we are now. So home. That's why I start doing this. Otherwise, I get crazy at home. But in this case, Marina, if you guys remove the jewelry, sometimes you have to remove the jewelry because it's not in a proper angle. So it's safer to remove the jewelry and let it close and re-pierce properly than keep it that way, and it's not going to heal ever. Okay, but if it's still savable, this is how we say it, you can do the other things to heal a bump without removing the jewelry. Okay, so always check with your piercer. If you have any questions, go to your professional, and if your piercer is not that professional, go and find another one. Okay, and I'm especially saying this to my clients in Egypt. We know how things work. Okay, so guys, thank you so much. Please, I'm going to keep this saved for a while. I don't know until when. Comment, make any questions you want, and see you next week. Okay? Thank you for watching.